Today's topic of discussion is the exchange of incisors. The exchange of incisors occurs in the first transitional period of mixed dentition. About the time of eruption of permanent first molar, the deciduous central incisors are lost and their permanent success starts their eruptive path towards the contact with the incisors of opposing arch. Usually, the mandibular central incisor erupt first, followed by the maxillary central incisors. These teeth frequently erupt lingual to the deciduous counterpart and move towards under the influence of tongue pressure as they erupt, as you see in these photos. The maxillary central incisors appears as a large bulge in the mucobuccal vestibule above the deciduous incisors before they erupt. Sequence of normal transition of incisors. At around 5 years of age, around the two-thirds of the roots of permanent incisors will be formed. The deciduous incisors will start exfoliating at the age of 6 to 7 years. The first teeth to exfoliate is the lower deciduous central incisors. At 7 to 8 years, the upper central incisors will exfoliate and the permanent central incisors will erupt. At around 9 years, all the incisors will exfoliate and the permanent incisors will be erupted by that time. The mesiodistal width of permanent incisor is larger than the primary incisors. Thus, the erupting permanent incisors require more space for proper alignment. This difference between the amount of space needed and the amount of space available is called as incisor liability. This was described by WARREN MAYNE in 1969. The incisor liability for a maxillary arch is around 7.6 mm and mandibular arch is 6 mm. So the amount of space for the erupting permanent incisor is required around 7.6 mm in the maxillary arch and the mandibular arch is 6 mm. The space discrepancy is compensated by mainly three mechanisms. One is the interdental spacing, increased intercanine width. One more is the labial eruption of incisors. Coming to utilization of physiologic space in primary dentition. Space present in the primary dentition helps in alignment of the erupting permanent incisors. The primary plate present in the upper arch mesial to the primary canine will also be used by the erupting upper central incisor and the lateral incisor. It's around 4 mm for a maxillary arch and 3 mm for the mandibular arch. These are the amount of space which is contributed by physiologic space for the erupting permanent incisors. Next is the intercanine width. During the transition from primary incisor to the permanent incisor, there is an increase in the intercanine width of both arches. The increase in the arch width of a maxillary and the mandibular arch will give an additional space for the eruption of permanent incisors. Change in the incisor inclination. Permanent incisor erupts more labially inclined as compared to the primary incisors where they usually upright. The permanent incisors inter-incisor angle is around 123 degree, whereas for the deciduous teeth it is 150 degree. They are more upright. So by proclination, some amount of the space is gained. This will also causes increase in the dental arch perimeter. The change in the labial inclination of the incisors also contribute to overcome the incisor liability by adding around 2 to 3 mm in the arch. So mainly by these three mechanisms, the incisal liability will be overcome by the erupting permanent incisors. Okay. Thank you.